Do you think that it's got anything to do with this? I've kind of been saving this a little bit, but this is from lawyer Lisa's Substack. I kind of end up with a bunch of hers and just kind of waiting because I'm not too sure if I want to talk about them or not. But this one, Unite, pushing decriminalization of drugs and a list of politicians adhering to this decriminalization. So it is kind of interesting that this happened, I think it was 2020. Some globalist organization pushing digital health certificates, decriminalization of drugs, and support for the pandemic agreement. Explore your country and the list of politicians loyal to the globalists, the drug policy desk. So at a global level, this drug policy reform debate continues to broaden, and the number of countries experimenting with different approaches to drug control towards better public health outcomes, particularly with respect to cannabis, is on the increase. So it just has a little thing here talking about the policymakers, international experts, and key populations and governments. But she's got here, the drug policy desk within Unite's network is uniquely positioned to provide parliamentary engagement support and accompany legislators who have the will to promote reform and to energize national debates on drug policy, fostering exchanges between an increasingly diverse group of it's all the wording, diverse group of parliamentarians and a wide range of stakeholders, creating a dynamic platform of debate. That sounds like it's AI written there. An initiative in the drug policy sphere. So anyways, what it does is it introduces these networked members to evidence-based approaches on drug policies. But I don't trust any of this, right? Building the capacities of members on thematic issue areas, providing technical and so here we go, parliamentary engagement support. So what are they going to write legislative changes and stuff? The desk priorities are to provide alternatives to incarceration, which is, I mean, this is what's happening in Canada, right? You saw that guy get out with on bail, and there was
after a year, I think, right? 1 year.
There was another one that just happened too, where I couldn't believe the amount of what he should have got, and decriminalization of drug use, regulatory frameworks for medical and recreation use of cannabis, and sustainable financing of harm reduction services. So they're talking about it right here, sustainable financing of harm reduction. So I don't trust any of this. And then I think it's been so between here's the politicians that are in the midst of this. See if any of these sort of ring. They're kind of involved with the World Health Summit and European Harm Reduction Conference, which harm reduction, honestly, is just not working. It's just not working right now. I mean, I know there's a whole bunch of people that still argue for it, but I just don't see it working. But here's
working in Alberta.
What?
It's working in Alberta.
Well, they're getting rid of it in Alberta.
Well, it's kind of a mix with a lot of heavy policing.
Yeah. So here's the Canadian ones.
And I think like forced rehab, basically, right? Is that the gist of it?
So, do you notice any of these when we've been talking recently about all this stuff?
No.
Okay.
They're also unremarkable. It's hard to remember their names.
Yeah. They quote some of Harari's stuff in here.
Harari's blowjob.
Yeah. There we go.
All right. I'm going to jump back over.